Role of therapy in relaxation technique. What are the relaxation techniques? Relaxation techniques are practiced to help brings about the body's relaxation response, which is characterized by slower breathings, lower blood pressure, and a reduced heart rate. The relaxation response is the opposite of the stress response. Some of the studies discussed in this fact sheets compare relaxation technique to cognitive behavior therapies. Cognitive behavior therapy is the type of psychological treatments that help a person become aware of way of thinking that may be automatic but are inaccurate and harmful. The therapy involves effort to change thinking pattern and usually behavior pattern as well. Relaxation techniques are therapeutic exercise designed to assist individuals with decreasing tension and anxiety physically and psychologically. Strategy to assist patients with relaxation have long been a hallmark component of the psychotherapy. However, they can be utilized throughout the healthcare environment as a complementary therapy to treat patients experiencing various types of distress, include but not limited to the anxiety, depression, pain, and stress. Relaxation techniques emphasize as a race of a strategy to increase feeling of a calm and decrease feeling of the stress. Feeling of the stress can include psychological response such as an increased heart rate, shortness of the breath, and muscle tension, along with the subjective emotional experience, and relaxation technique can aid in the reduction of the symptom. Many variations of the relaxation strategy exist and can be facilitated by a variety of the health professionals and learned via self-helps. What is the role of relaxation technique therapies? A therapist is a trained professional who have received undergraduate and graduate level training. Therapists receive supervised clinical training, include hundreds of hours of education support, specialization in mediation, helping others understand and identify feeling, supporting and decision making, and providing guidance for the life decision. Therapy provides valuable support to the client. Therapists often provide individual, group, couple, or family therapy session for a variety of age and needs. It is the therapist's responsibility to establish the boundaries of the therapy situation. This includes a wide range of the boundaries, include a safe environment. It is also the therapist's role to define what exactly is a psychotherapy is, because what constitutes psychotherapy is different for the different therapists. It means using different methods that define the way they practice. A major part of the professional role of the therapist is to facilitate the awareness, growth, and psychological development of the patient. The uniqueness and strength of the patient and therapist relationship form an identity for the therapeutic inquiry and growth. The therapist develop a relationship with the patient through activities and empathic listening, caring, and warmth. Under the humanist psychological approach, is understood that the rapport between the therapist and patient is predictive of the successful treatment. And understanding the patient also helps the patient process. Therapy is a relationship between the patient and the therapy in which both are expected to change through their interaction. In this process of the therapy, as the relationship grows and develops, the patient is expected to change and grow more than the therapist. One of the goals of the therapy is to explore the factors that may interfere with the relationship between the patient and the therapist. Does the therapist remind the patient of someone he or she resents? By delving into this factor and identifying them, effective strategy can be developed in the relaxation technique process to help the the healing process. Typically, the barrier of the better relationship is that in the therapy become microsomes of the barrier relationship with people outside of the therapy. A key success therapy for the in the relationship technique process is key success to the healing process is the authenticity of the therapist. Being genuine and transparent is vital to the success of the relationship. This is because a reflection for the patient striving to the congruence in their interaction with the therapy, as well as striving to be congruent outside of the therapeutic situation.